thank you. And it's so lovely to see so many familiar faces in the audience. And at the afternoon tea break, people were looking at me as if to say, do you remember me from this phone call? And I just wondered if I can just indulge myself. Hands up if I've spoken to you on the phone. Yeah, quite a lot of you. So hello, everybody. I'm Kate behind the phone and the email. So just before I start with this, I just wanted to plug, I don't think there's any of these booklets left at the back. This is the Patients and Carers Guide to Neuroendocrine Tumours, but all of our resources are available to download off the website. Or if you'd like a hard copy sent to you, then just get in touch via the website and we can send out a hard copy. The other thing I just wanted to show you, because I haven't had a chance to show everybody yet, is some new wallet cards that just have been launched over the last few months. The first one is for people with carcinoid syndrome who suffer from diarrhoea. It's a card that's designed to go in your wallet, and it's for people to be able to use a toilet urgently. So it says neuroendocrine tumour carcinoid syndrome. The holder of this card has a medical condition and needs to use toilet facilities urgently. So we've never had any reports of anyone being refused use of a toilet. So you can take it into a cafe and not feel like you have to buy a drink there just to use the loo. So that's a handy one. The other one is for people, and this is not relevant for every person, but for those who experience carcinoid syndrome, there can be the risk of carcinoid crisis under certain circumstances, like under anaesthetic. So we've got this card that can be used. It's got some medical information about managing carcinoid crisis. So these are available. Again, you can download your own from the website, or we've got some up the back. But just to reassure people that this is not a high risk for every person with a neuroendocrine tumour, but if you're prone to carcinoid syndrome, feel free to grab one and even talk to your oncologist about whether this is something that you should carry around. We don't want to alarm people, and there's lots of people, heaps of you in the room who this is not a concern for, but we know people who have had a carcinoid crisis. They're woken up after a knee arthroscopy and been told that they needed to go to intensive care and have all sorts of support. So, yeah, those two cards. Now, quick, because time is marching. So there we go. So I'm not going to belabour these points. I knew that we would be covering some of these statistics, and we hear these things all the time about the delays in diagnosis with NETs, and the fact that over half of our patients have disease that's metastatic by the time they get to that diagnosis. We already know that more than half of people with neuroendocrine tumours are diagnosed with something else before they receive their diagnosis of neuroendocrine tumour, and often that diagnosis is not correct. So these are all things that we know, and we've heard a lot today about some of those issues. We know that there is a burden for delayed diagnosis. There's a burden of physical symptoms, and we're told that it's good news because it's a slow-growing cancer, but then if you've got a slow-growing cancer, that you've got a really great prognosis in terms of lifespan, but your life is so limited by this debilitating diarrhoea or other symptoms, that's a lot to live with on a day-to-day, week by week, month by month, year by year basis. We've also, we've got people in this room from a whole different range of locations, and we had our consumer advisory group meet this morning, actually, and we were really becoming even more acutely aware of the disparity for people based on where they live. So location, our regional and rural patients really do it tough. Even with reimbursement schemes for treatment, it's still really, really challenging to get to see someone who knows about your condition, but also to have someone local who can manage you on a day-to-day basis, and that's very complex for people. We know also there is a variety in the level of knowledge amongst amongst specialists out there in the real world, and that's a challenge that I talk about a lot with people over the phone, and we workshop strategies to get around those issues, but they're very real issues. And just the psychosocial impact of being told that you've got cancer. It rolls off the tongue a lot of the time for health professionals because this is our bread and butter, but for you, this is life-changing. That word, that diagnosis is life-changing. So yeah, we're told it's good news. We're kicking goals. You know, we had specialists up at the front talking about the clinical trials that are in development, the way we're able to map the genome and you know, pull it all apart and work out why it is that we're getting these tumours and what more we can do about them. And people are living longer and longer with NETs. And I know the doctors love to stand up here and talk about the success stories. I'm looking at Sue, who's nodding her head and 20 years down the track. And, you know, so we've got really great news. We've got lots to celebrate. We've come so far.
20 years ago, there was absolutely nothing.
And 20 years ago, there was nothing for you. Yeah. So where does all of this leave us? Because it still leaves us in this room. We're not out there not needing to deal with this. We're all in this room because we've still got a need to be dealing with it. On one hand, it's all thumbs up, mate. And on the other hand, there's still this grappling of, well, how long is my piece of string? If you can't make my tumours go away completely, or you can make them go away this time, but we think they're going to grow back. And it was interesting looking at Lisa's findings from the Defining NET study, and for a significant number of people, that living with uncertainty, that anxiety around scans and results, you know, just that managing that fear of it coming back, it's overwhelming for people, and it really has a huge impact on people's quality of life. And then there's the pile of bills and paperwork. You know, I've talked to people who say, well, I feel like I need a personal assistant for all of the, you know, keeping track of all of it, all of the information, all of the, and there's a huge financial impact from all of this. It can make people feel pretty unravelled. So I wanted to talk to you a little bit about the concept of survivorship, and I know we've got only just a couple of minutes. I've looked at my clock, so we'll try and get you out fairly much on time. But I wanted to talk to you about this concept of survivorship because traditionally survivorship has really been talked about in terms of cancers that we cure. So, you know, 10 years ago we were talking about survivorship of breast cancer, where, you know, we cut the tumour out, we give the person some chemotherapy and maybe some radiotherapy, and they have no evidence of tumour. We say, you know, you're probably cured. Here's what you need to do to live well, having had this happen. So we were talking about it with those more curative kind of intent cancers and the more common cancers. But what we've realised is that people who are living with a long-term cancer, even if we're thinking that we can't make this go away, there's still survivorship issues for you. And so I don't know if you can see on that wheel, but there's things like emotional wellness, sexual wellness, you know, setting goals, because we're not looking at palliative care and end-of-life care, thankfully. We're not. For most of you, we're not for a very long time. So how do we stay well in the context of ongoing disease? How do we help you exercise? How do we get you nutritionally well? What about spirituality? What about emotions? What about family? So, you know, so survivorship care needs to focus on things like coping with side effects of treatment, and often that's a very long-term picture, of managing follow-up care. How often do we need to do the scans? Do we need to do them that frequently? What's the plan here? Providing emotional support for these really very real psychological issues. Looking at legal and financial concerns, and we know, like, that came out in Lisa's study, but we're just about to close this financial toxicity study too, which is going to give us even more rich data about the nature of financial concerns for people with NETs. But we know anecdotally that this has a huge impact. And when you don't know how long your piece of string is, you don't know how long you need to make your savings last for. So it's the double-edged blessing kind of, you know, oh, good news, we can't make your cancer go away, but hopefully you're going to be living for a very long time. But then you go, well, I'll make a bucket list and go overseas, but then if I spend all my money and I'm still alive in 5 or 10 or 15 years' time, that's also really complex and tricky. So, and healthy living, like preventing other cancers. I've got people who have been living with NETs for many years and they've got something else. So we need to be looking at that too. So we've been working on a survivorship care plan project for NETs. So survivorship care plans encompass information for people around all of the things on the previous slide, and they've been widely endorsed, as I said, in other cancers. So it's essentially a summary of treatment, It's a list of things like side effects and symptoms to monitor and report, and importantly, how to do that. So the contact numbers of the people that you need to ring and when you need to ring them. Recommended follow-up plans so you know where you stand, and strategies to remain well. So this project has been a collaboration between the Australian Cancer Survivorship Centre and Unicorn Foundation Australia. So the Cancer Survivorship Centre is associated with Peter McCallum, and they did an initial study a few years ago looking at what information elements were required in a plan like this, how people wanted this to be delivered. You know, did they want an app? Did they want a piece of paper? What sort of thing did they want? And how would they use a plan like this? Because, you know, we could develop a really shiny plan and then it not be useful for people. So we wanted to make sure that that was something that people needed. So what we found was that, A, it was highly desired, that this was actually something that people really wanted. But we needed to change the language because when we did that study, people with NETs didn't actually think of themselves as survivors. And it makes sense. I guess if you're living with a liver full of tumours, maybe you're thinking of yourself in a different way than a survivor. So the project is now called the NET Treatment and Wellness Plan, so that's what you'll see on any documents about it. And the key elements that people wanted were they wanted it paper-based, and to include the treatment summary, symptoms to watch out for, what am I having, what tests, what, when, a list of side effects and how to manage them, a plan for follow-up, and really importantly, who to call. And, you know, I have these conversations with people all the time on the phone. I've got this niggle, I've got this symptom. I don't even know if this is relevant. Is my doctor going to know about, you know, going to want to know about this? When do I need to worry? And so hopefully this will take some of the guesswork out for people. And just to go back, that's a little picture of what the plan looks like at the moment, but it's going to look prettier. So, and importantly, it's going to be customisable so that people can, sections can be added in for if you've had a particular sort of treatment or taken out if you haven't. So we've been developing a template for that, and it's been reviewed by our consumer advisory group. And the people in the black t-shirts, you've actually been mentioned a whole heap. It makes me realise how much we make you guys work. So thank you so much for all of that. So we had it reviewed by a key bunch of health professionals all over Australia and our consumer advisory group. And the next step is really a pilot project. So we'll be looking to just do a small pilot to get evaluation for it to be tested out there in the real world, and we'll probably come back with a whole heap of tweaks and changes from there. So we're thinking probably at this stage we'll be hoping to pilot in Adelaide and Melbourne and Brisbane, with just a small number of people and a small number of health professionals. So I wanted you to be familiar with this concept because A, you might be involved and asked to participate in the pilot and to give us feedback about the pilot. But when this is a solid resource, it'll be available like all of our things from download from our website, and it'll be available for anyone around Australia or worldwide who want to use this. And you know, you'll be able to print it out and take it to your healthcare professional. I just wanted to finish by telling you an anecdote from a lady, and I presented this study. I know, it's good, isn't it? We all need a bit of funny at the end of a day. A lady from New Zealand who I was telling a New Zealand patient group about this study, and she said she'd had some chemotherapy in New Zealand, and she'd come to Australia to, and I can't remember, was she here for a holiday I think she was here for a holiday. She was visiting family, and she was very unwell and presented to the hospital, but she didn't have any of her records with her. So, you know, she'd had a lot of treatment in New Zealand and, you know, really quite complex disease, but she presented to Royal North Shore, which is a hospital that manages NETs, but their emergency department didn't really know what to do with her, and she had some blood levels that were very low, and they suggested a blood transfusion. She didn't really understand what they were suggesting, and she was worried that if she had a blood transfusion, that would wash all of the chemotherapy out of her system and render her treatment worthless. So she refused treatment, and she went away with these really dangerously low blood levels. And so her point was, gosh, if I had something like this, a summary of the treatment that I've had, what scans are coming up, who to contact, she could have given that to the triage desk at the hospital that she was presenting at, and they would have had all of the information they needed to be able to therefore manage her. So we're thinking it's going to be useful for people when they're travelling, but also as a communication tool between people and their NET treatment centre and their GP. So, yeah, we're excited about this project, and I was really keen to share it with you. And thank you so much for hanging in with me right till the end of the day. I think we probably need to finish. I don't know if we've got time for a question or two.